all welcome to today's parent support group, 20th of March. This is the third series. I welcome you all for coming. So today, our topic is about autism and food. So the aim of this program is to highlight what the topic entails and to give room for all of us to ask questions and contribute so that we can learn more in terms of that. So today's topic is autism and food, the hidden connection beyond picky eating. Now, we all know what autism entails, so no need to talk about that. Now, we'll also look at how is it related to food. Why are children or individuals with autism spectrum disorder picky about foods? Why would they prefer one food to the other? Why would they decline to eat? Why would they not want to try new foods? So these are some of the things we are going to look at. Sometimes it might be as a result of their choice, sometimes it might be as a result of different issues. But first of all, it's pertinent that sometimes people decline something by communicating and said, I don't want this thing, and we give their reasons why they don't want that particular thing. But looking at the peculiarity of individuals with autism, that communication is an issue. So most times to communicate the reason why they don't want a particular meal, why they don't want to go to a particular place might be difficult. Therefore, the reason sometimes they might just decline, but might not communicate their reason why they decline such thing. Sometimes children with autism might not want to take foods. Maybe they have an underlying condition. Is it possible they might have toothache? Is it possible they might have sore in the mouth? Okay, or maybe sore in the gum. Or maybe there's bone in their throat. So all these things are possibility why children with autism might not want to eat. So it's good for us to explore that reason first and find out, is this actually the underlying reason why they don't want to eat? Is it because there's an underlying condition? Is it because they have toothache? Is that why they don't want to eat? Because they find it difficult to communicate their reasons. They'll just maybe use two words, don't want, no, no, no. And you and anybody as a parent will be frightened or we feel confused because of difficulty understanding what is actually happening in terms of that. So most times we try to rule out this underlying condition, maybe by trying to find out, maybe by inquiring where the child has been previously, what has happened to the child previously, or maybe by visiting a health practitioner. These can also help to take care of it, to actually find out if there's an underlying medical condition that has not been looked into to help this child to fit better. Or is it maybe because now let's also look at they being sensitive. We have talked about their hypersensitivity or hypersensitivity to issues or to things. So their sensitivity might be as a result of the texture of the food. Someone said John likes to eat. Someone said John likes to chew, but don't like to take soup. Is it that John is scared? Maybe he might choke taking the soup, or maybe he might choke taking a bar or anything. So John prefers food that he can easily feel than food that he can swallow. Or maybe John, being a child with autism, prefers food that he can swallow than food that he can chew. So that might also be a reason. They are scared. They are sensitive to these foods. So because they are scared and sensitive, they will not want to take it. You will tell them, come and take. The response they'll give you is no. They might be to say, oh, mommy, daddy, this is why I don't want to take the food. This is how I feel. I'm scared of the food. That difficulty in communication might make them say no. but it might actually be as a result of the texture of the foods. The feeling of the food in their mouth might make them not want to take it. Or maybe it might be as a result of the environment. We understand that children with autism, they they have this peculiarity of sameness, repetitiveness. They want a pattern of behavior. They don't like change. For them, thing needs to be constant. They don't want to try new things. They don't want to try new experience. They don't want to try new foods. Okay, so it might be as a result of the change of utensils. Maybe the spoon he or she was using before has changed. Maybe the cup, maybe the clothing on the table, maybe the environment. Is the environment too noisy, environment too loud, or they don't like the arrangement of the plate or such thing. So the environment also can influence their decision to eat, can make them picky or look picky, that they don't want it. So when the environment, they'll go to a restaurant, the environment will be noisy, they will not like to eat. Might just scream. Then, and it might make the parents feel embarrassed or feel uncomfortable in that situation. And because of that, they decide they'll make a decision not to take the child to a restaurant again. So sometimes it might be as how noisy it is. So understanding the environment they are used to will help them in terms of trying new experiences. Okay. In some more developed climes, there is usually peculiarities, all-inclusive restaurants, peculiarity. They have table setting, uniqueness of children who have autism. But in our environment, might not see those peculiarities. Okay, so these are some of the few things that might make a child with autism spectrum disorder to be picky, to want a particular food and not to desire another one, not to want to try new foods, to prefer chewing to swallowing or to prefer swallowing to chewing. These are just a highlight of some of the connection between it. Okay. Thank you very much for these brief highlights. I don't know if anybody has any other contribution or questions. The floor is now open for everybody to contribute or ask questions. Thank you very much.
Thank you so very much, Dr. Paul. Thank you for that contribution. We're indeed very grateful. So this evening, I'm Dr. Adegbite. This evening, we're looking at a very important topic in children with autism. We're talking about eating problems, particularly that has to do with picky eaters in children with autism. And Dr. Paul has been able to highlight some of the possible causes of this eating problem in children with autism spectrum disorder. So now the floor is open for contributions, questions, additions, subtractions. If you have any experience, how you were able to deal with the problem at a particular time or the other. I welcome you all once again. So the floor is open, please. If you have questions, if you have contributions, please feel free. Thank you.
Hello? Hello?
Oh, hello, we can hear you.
Oh, okay. My name is Esther. I just want to say a little bit. I listened to Dr. Paul, and I think he has basically touched on or summarized what it is. I'm a special needs mom, by the way. I have a 16-year-old, and this was some of my experience with my son having issues with feeding and things like that. And like he rightly said, a lot of times it's the first thing to do would be to check if there's a medical issue, whether it's toothache, like why is the child not eating? And when that has been ruled out, then you can look at other things as well. For me, it was clear from the get-go that he had sensory issues. So that was part of our major problem.